Navigating Medicare can be difficult. There are so many medical terms, many times important things like your preferred doctor, and the price of prescriptions can change. To help make everything easier to understand, we want to welcome Becky Hayward, the Outreach and Education Supervisor for Ohio Senior Health Insurance Information Program. Good morning, Becky.
Good morning.
So first off, I guess for folks who are unfamiliar, what is the Ohio Senior Health Insurance Information Program?
Well, we are an unbiased, objective resource for people in Ohio to help people navigate the Medicare system. So we are a federally funded program through the Administration on Community Living, but we are also a division of the Ohio Department of Insurance. So we are here to be that resource for folks that's free, objective, unbiased. So we're not agents and we don't work for insurance companies. Okay, so
obviously the information is really key here. For folks who heard the term Medicare, what is that and who is eligible?
So Medicare is federal health insurance. Anybody who's 65 years and older is eligible. We also have folks who are eligible due to disability. And then we have folks who might have kidney failure or ALS, Lou Gehrig's disease, would be eligible for Medicare. You get it because of those eligibility. There's no income requirements. There's no limited resource type requirement. We work for Medicare benefits. It's taken out of our paychecks. And then once we are part of one of those groups, we are eligible to get that health care benefit from the federal government.
So Becky, I know we are going to be having a phone bank tonight from 4 to 6:30 right here on WCPO 9. What are some of your other outreach initiatives for Ohioans who are current Medicare beneficiaries or might become one soon?
So this time of year, we like to do our Welcome to Medicare campaign. So we have over 10,000 people a month in the state of Ohio going on Medicare. So we need to reach those folks so that they know what to do when they go on Medicare. So we do a lot of Welcome to Medicare events, both virtually and in person around the state, including here in the Cincinnati area, to help people understand what their benefits are and who can assist them and how we can help. And we also have volunteers who also assist folks as well that might sit with them face-to-face to do events. And then we do, as I said, our Welcome to Medicare events virtually. So we do offer welcome events via webinar as well.
Okay, so I'm sure this is a question you get a lot. People often confuse Medicare and Medicaid. What's the difference between the two?
So the difference between the two, Medicare is that federal health insurance that we're eligible because of age and disability. There's no income requirement. Medicaid is the aid for the health insurance. So it is a federal and state relationship, and it's still health care from the state, but you have to have low income and low resources. It's not based on age, and not everybody would be eligible for a Medicaid benefit. Now, the two can work together, but most people then are eligible for Medicare first due to the age, and then you would add that Medicaid benefit if you have very low income, low resources.
And Becky, what sort of help's available for individuals who might struggle to pay for their health or their drug coverage?
So the federal program through Medicare offers assistance to pay for Medicare Part B. So Medicare is not free, and it's not 100% coverage. So there are costs that are associated with the program, and there is a monthly premium that everybody must pay. It's Part B that's $164.90. So some folks who have low income, low resources can get assistance through the Medicaid department to pay for that Part B premium. Also, folks can get assistance to pay for their prescription drugs. So we know prescription drugs are expensive. And there is a Part D program through the Medicare that does help assist some of those costs. But extra help through the Social Security Administration can help folks even lower those costs even further. Maybe no premiums, no copays, no deductibles to have to meet. So at OSHIIP, we help screen folks for these programs to see if they're eligible, and in some cases we can even help them enroll.
Well, certainly very helpful. I know we can only cover so much in the time that we have here right now, so if somebody's watching this and they have additional questions, Becky, where can they go?
So our hotline, or I like to call it our helpline, they're available Monday through Friday, 7:30 to 5. Our number is 1-800-686-1578. And those are folks that are in Central Ohio, and they're able to answer calls all day long and assist. They can navigate folks. We're also an education and training program, so we do have folks who are local volunteers, and so they might be within a community at a site that could sometimes sit down with somebody and work face-to-face with them, again, in this objective, unbiased type situation. And then through our staff as well, we do virtual counseling. So maybe you don't want to meet face-to-face and you want something a little bit more than a phone call, and we might connect on Microsoft Teams, which is like Zoom, and share screens and talk and go over their benefits as well.
Well, Becky, thank you so much for taking the time to join us today and talk about this. And just a reminder for our viewers at home, there will be a phone bank happening tonight from 4 to 6:30 right here on WCPO 9. The number to call with your questions, 513-840-WCPO. That's 513-840-9276. And Becky, thanks again.
Thank you.